Welcome to Mahaska Health Medical Minute, where we will talk with your local trusted experts to bring important healthcare topics for you, your family, and our community. Today, talking about vaccines is Patty Malloy, Public Health Coordinator here at Mahaska Health. Patty, this is, I believe, week 4 of us catching up and talking about the vaccine and being allocated. The most recent update. Let's start with that. In a few words, we'll go through a series of questions. Tell me right off the bat what we're looking at.
Yeah, currently we are finishing up some of the 1A vaccines, and we have been waiting for our allocation for the 1B, phase 1, tier 1. Currently, we did receive notification today, Wednesday, of that allocation, and it was much smaller than we had anticipated. We received 100 doses. So we know that's not enough. We, have talked to the state regarding this. All of the counties received doses, and many similar to ours.
In your words, feel like we have most successfully completed 1A. If you feel that you are in that 1A category, please reach out to our public health department and get that set up. But I think that's a nice, successful thing to have on our belt at this point. And we do appreciate everyone's patience and thank our community for understanding the process that is in place per the CDC and continue to work together based on what is allocated. And Patty is, of course, doing her best and succeeding with that. Patty, how do you feel that nationwide shortage is affecting Iowa?
Yeah, so each state is allocated so many doses from the federal government. Those doses are then given out per county. So through the local public health, larger metropolitan areas may have other entities that are giving it. Currently, because of our low volume that we're receiving, public health is currently allocated those doses. So once we see the numbers increase for our allocation, those can go to other entities in the community, our pharmacies and places like that. But until then, we are working through the phase 1B allocation and just doing that the best we can.
Mahaska County, you said, received 100 doses. Was it yesterday or today?
We received the number today that's what we would be receiving. We will get those hopefully the beginning of the week.
Good. Just wanted to make that clear. And also, Mahaska County is not alone. Surrounding counties also have been allocated in that preceding getting the 100 also.
Yeah, absolutely. We did some checking around. I called around and just wanted to know, why were we giving that number? And it, the answer was all 99 counties were receiving vaccine. There were many that received the 100 doses. Our job is to get those out, and that those will go out quickly as possible once we receive them. We just ask for your patience. I know people are calling, and we've told people to call the end of this week. Today's the 27th, but we said we hope to know more. We do know more, and obviously that's not enough to get through that phase 1B. So we will do the best we can.
And just to put a little perspective on it, large communities, let's say we look at a population of 80,000 people, they only could be getting 10% of that dose. So that's a huge...
Yeah, that's exactly what we were told. We want to bring it, have everybody get a little bit instead of one place getting a lot. That's the way they chose to do it.
The shortage affecting 1B tier 1, that's what we're looking at right now.
Correct.
Where are you at in that process?
Today we did our, last clinic that we had the 1A healthcare workers. Long-term cares, again, are being done by the bigger pharmacies, Walgreens, CVS, and community pharmacies. We did, start with some of the 1B teachers, law enforcement, that group a little bit because we needed to fill in. Once we, there's a lot of logistic to this. It's not just a one dose for one person and we're good. We open a vial, we have 10 doses. We need to use those in 6 hours or less. So we need to have groups of 10. So that's how we did it today, just to kind of get started on that grouping. The next amount of vaccine that we get, we'll be giving, again, kind of finishing up that tier 1 and the 65 and older.
Well, true statement. We are not wasting one single dose.
Absolutely not. No, we're not going to waste it. If we have to go on to the next tier, that's what we've done, but we will not waste any doses.
And that's why you may see some of them 1B getting touched because of that.
Correct. And the state did tell us we could do that, so that's what we did today.
A quick clarification scenario. I have a grandparent in long-term care facility. I want to make sure they're taken care of. How are they getting reached by these CVS, Walgreens. Do you know anything about that process? How would I know my grandparents getting taken care of?
Yeah, so the long-term care centers here in Mahaska County have all completed their first dose. So that has been done. I believe some will be receiving second doses probably next week. Last week, the one long-term care got completed in assisted living. So, they're on the schedule of Walgreens, CVS, and community pharmacies. So we don't have anything to do with that, but we know that those doses are separate allocations from what we receive. The governor spoke today, so if you've listened to that, they are asking for some doses back if there was extra doses from those clinics that they've done.
Good. And just to clarify, we do record on Wednesdays. So, when listeners are listening to this, we may, that would reflect back to the governor speaking, which is today, Wednesday.
Yeah. And then just one thing I want to say is that when we record, things are fluid right now. Things are changing quickly. I know last week we recorded and the next day the governor spoke and it went from 75 and older to 65 and older. So bear with us. That's kind of what we're dealing with is change and just kind of follow on that.
The plan for Mahaska County. What's your next step?
We will be receiving those 100 doses. We will be getting them out as soon as we can. Again, we can't take a list just because it's a lot of calls we're receiving. Be patient. We'll put out on Facebook when we have a greater number. In the beginning, we tried to take lists, and it just got, with all the calls coming in and taking lists, that was just really difficult. To find more information on public health and when we are taking appointments, follow us on Facebook, mahaskahealth.org, emergency management. Those are all sites that are going to be putting that information out for us.
I heard you talk about fielding a number of calls daily. Same questions, do you feel?
Yeah, when can we get our vaccine was the number one question. And right now, hopefully, here in the next week or two, we'll get more vaccine. I believe it's coming. Just be patient.
And we continue to work with the school systems, the first responders, to get the vaccine distributed. Just a quick reminder, another scenario. I'm a teacher. Who am I going to contact? I know that their administrator is responsible for the communication on getting them that vaccine. Is that still what you feel needs to happen?
Yeah, we have a weekly call with the superintendents of the schools every week. We have asked them to put out a survey to their staff, and they've given us those lists. We also asked them to kind of tier the staff, those staff that are with students that maybe aren't able to wear masks very well, or depending on what their position is in the school, kind of tier it 1, 2, 3, and that's kind of where we're starting. We want to, be fair, and that seemed like a good way that the state had kind of given us that information, but we just felt like was the easiest to do.
So you forwarded that information to the administration.
Yeah, I feel like we've had great communications with the schools and other entities. If you haven't heard from us or sent us an email or heard back from us, by all means, get a hold of us here at Public Health. Our direct number is 641-672-3257. Listen to your voicemail would be a good idea, just so you know where directly you need to go, what department. It's Public Health. Some people, get that call. They just call the number right back and might shift you around before you get to where you really need to go. So listen to those voicemails that we leave if we're able to, and we kind of give you instructions on how to get a hold of us.
Patty, you've done wonderful with being successful in getting these doses out, timely manner, communicating, service lines in the community.
One thing I'd like to say is until we get enough vaccine, we need to have people continue to mask, social distance, wash your hands, just take all the precautions that we've been doing so far. We've, seen our rates, decrease, here kind of across the state since, the fall, the November, Thanksgiving, Christmas time, but just still take precautions. We want to make sure that everybody stays well and healthy until we can get some vaccine out there.
Wonderful. And continue to follow Facebook and our mahaskahealth.org website for the banner on top of our page for up-to-date information. Thank you today, Patty, very much.
Thank you.
Mahaska Health is dedicated to caring for you. We have a team of experts putting everything they have into your health and getting you back to what matters most. Same-day appointments are available, and our walk-in is open 7 a.m. to 7 p.m. Monday through Friday, 8 a.m. to 4 p.m. Saturday and Sunday. Our telephone number is 672-3100, and feel free to visit our website, mahaskahealth.org, for up-to-date information.